There we go. Well, hello everyone. Good evening. Thanks for joining us again. Really, we just wanted to kind of bring you all together again. Some of you may have started your rotation. I think most of you, though, are probably starting a little later this summer. But wanted to give you the opportunity to touch base with a couple experts in the experience. We have 3 students that were in the program last summer to share about their experience, challenges, best practices, tips from the whole summer. Feel free, we'll keep this informal. If you have questions, throw them in the chat, unmute, ask away. We do have some kind of standard ones to kind of get us through as well, but definitely want this to be for you all to kind of get what you might need as you're preparing for your rotation. My name is Caitlin McGuffey with the OASU Foundation. If you missed, so welcome. But I also have a new face with us tonight, and that is Sage Fotheringham. She is joining the foundation and the academy. We'll be working on our national conference, scholarships, Ohio reception, and then anything we dream up in the foundation. She'll be my new kind of counterpoint there. Some of you may also remember the other Caitlin. She's still around too, and we'll be working on workforce things. So as you get involved or maybe decide family medicine is for you, she'll be another great contact still too. So that is all of us. I will just let's just jump right in. We have with us Anna, Ethan, and Emma. All were in last year's program, like I mentioned, and I'm just going to turn it over to them, have them introduce themselves, their school, and then where they did their experience last summer. So let's see, Emma, would you like to start?
Sure. Hi, everyone. I'm Emma. I am a rising M3, and I did my rotation last summer in the first half. So I started in May, and it was in Canal Winchester with Dr. Jennifer Davis. Oh, and I go to OSU. Sorry, I forgot to mention that.
How about Ethan?
Hi, everyone. My name is Ethan Vo. I'm an M2 at Neomed. I did the program last year with St. Elizabeth's residency program for family medicine in Boardman.
Wonderful. And Anna.
Hi, I'm Anna. I am a rising 3rd year at OUHCOM, the Athens campus, and I did my preceptorship last year in Dayton with Dr. Andrea Dillon.
Wonderful. I know some of those preceptors tend to do it quite often, so maybe some of you will be in the same places too. We'll get it started. Just kind of go over what made you decide to participate in the program last year. This family medicine experience. We'll go backwards. We'll start with Anna. You guys can just jump in if you want to.
So I decided to do the preceptorship because I have always been interested in having long-term doctor-patient relationship with patients, and family med is one of the only specialties where you get to really do that consistently. And so I just wanted to find out more. I kind of thought going into my preceptorship, oh, maybe I'll do med peds, maybe I'll do internal medicine. I'm really interested in doing diabetes as a focus later on. But wanted to get more information, and I learned a ton during my preceptorship about how I could do that without doing those other specialties, and how I could actually get more of the things that I wanted by doing family med. And so it was a really good experience for me, but I just wanted to get more information and wanted to work in some clinical experience over the summer because the rest of my summer wasn't so clinic focused. So just for interest's sake, I guess.
Perfect. Ethan, we'll go backwards from before.
Yeah, so I did the preceptorship program because kind of what Anna said. I'm sorry, I have a lot of echo right now, so I'm hearing the.
I think I got it. You're good.
Thank you. So I wanted to do it just to get some more experience in primary care. I knew it was something that I was interested in M1, but I didn't have a whole lot of clinical experience. So I wanted to do something where I can kind of go and see for myself if this is something I would like to do. And I also knew that I didn't want to do a program that would eat up my whole entire summer. So I wanted to do something where I was like, okay, this is a month. I'll go like really hard full time, but I know I'll still have at least a little bit of summer to have for myself. So I thought it checked off the boxes for me.
My reasoning is kind of a mixture of both what Anna and Ethan said. So I came into med school really wanting to do pediatrics, and I told myself that was all I was going to do, and I was never going to consider anything else because I love kids. But then my friend really kind of encouraged me to look into this program. So I was like, all right, I do want to do something over summer, but I don't want it to take up the whole time. So how about I do something clinical that sounded cool. So I tried it out, and I came out absolutely wanting to be a family medicine physician. So it's a pretty, I would say, like career changing experience. And I loved every second of it.
Love that, gold star. Well, thank you for sharing those. It's always helpful for us to hear too, kind of why students are choosing this program and how we can like amplify that in our promotions and things. We have found that word of mouth. I think you mentioned your friend said to check it out. So hopefully you all get similar experiences this summer, and we'll spread the word too. Are there any, before I kind of go into our questions we have prepared, does anyone have a burning question that they wanted to get out there? Okay, well, let's see. Did you prepare in any specific way before you started? Or connect with the preceptor or the practice beforehand, and any preparation sort of tips before you jumped in?
I can go first. So in terms of like preparation and like preparing for knowledge, I did not do anything for that. I was literally coming back from vacation at like 2 a.m. the morning right before we started. So I didn't do any preparation in terms of that, but in terms of getting connected to the location, I was really fortunate because I went to undergrad at Youngstown State, and some of the doctors from St. E's taught in a course there. And one of them was the family medicine residency director for Boardman. So he was super cool. I wanted to learn a little bit more about the specialty, so I reached out to him. He invited me to didactics, and when I came there before I started medical school, it just was such a great environment. I knew if I came there for the summer to do the preceptorship, it would be a really great fit. And they've hosted students before, so it just seemed like that was the place for me.
I can go next.
Yeah, go ahead.
Okay. So I also didn't do much to prepare like content wise, or like kind of like any like school type academic review. I didn't really do. I did take some of the advice that I got last year on this panel as a student and just bought some Post-it notes. I thought that that was a really good piece of advice, and so I always had them in my pockets. I feel like that was like the best thing to do to prepare. So maybe take a note of that. And as far as like contacting the place that I was going, I actually had shadowed Dr. Dillon when I was just fresh out of undergrad. I'm a non-traditional student, so I took a couple gap years, and I had shadowed her like 4 years before. So it was nice to come back like after my first year of medical school and like get to shadow again. And so we just emailed. I like sent her some questions that I had, and she emailed me back, and we just kind of talked a little bit like that. And like that didn't take up a lot of time, but just like, hey, this is what I'm excited about. Like, is there anything on your end that you think that I should do? And then just let her kind of like guide that. But it was just really low key, and she was super, super nice.
Could you share the Post-it tip in case no one has seen the last year's video?
Sure. So one of the guys on my panel last year said that he takes Post-it notes in with him into like every patient encounter. And I think he had started clinicals too when he was on the panel. And he said that he did that even during clinicals. So just like jot down any questions that you might have that come up in the moment without like taking like time away from the patient, but you can like write down your questions for later, or anything that you might want to like look up later because like you kind of remember it, but you need to like jot your memory. So just like always had Post-its and a pen in my pocket for those instances, and that was really helpful.
Could someone use an iPad instead of Post-it? Okay, good.
Yeah, I used my iPad, but instead of taking it into the room, what I would do is try to like really actively listen while I was in there. So I would just go in the room and try to absorb as much as I could and participate as much as I could. And then that way when I would come out, I'd write down everything I remembered on my iPad, and that made it more memorable, I feel like. Yeah, I've used my iPad.
Did you have anything more to share about preparation, Emma? Cool. I think I need to use the Post-it tip for life and just have them everywhere so I don't forget things, probably. Let's see. We've got a couple questions in the chat. What was your favorite part of the program? I think that was one of our questions we jotted down too. So we can jump right into that. Kind of the favorite thing that stood out from your experience. Ethan, I'll take on you first.
So probably my favorite thing about the program was the diversity that I got to see in terms of like ages of patients and locations. Because it was a residency program, they didn't just put me in the outpatient clinic. I was also in the newborn nursery and also rounding inpatient as well with residents and attendings. So in terms of my absolute favorite, I think probably newborn nursery. It was my first time working with like these little tiny humans, like as a medical student, learning how to do physical exam on them, like interacting with the parents. So I thought that was really unique.
I can go next. I think what I loved the most was just the being able to put patients' faces to the things that I've been learning at the time. So I just finished up N1, so I'd only really been through like half of the clinical material, but even then there was still a lot of things that showed up that I had learned about, and I thought that was just the coolest thing. And it was I guess a taste of what rotations would be like. And it was very exciting to get to practice these things. And my preceptor was really laid back, and it was awesome that I got to be as involved or as uninvolved as I wanted to. But I think that really helped me gain confidence in my like physical exam skills and things that I didn't necessarily get to practice so much in my first year. So for example, I remember one day she asked me if I wanted to do the shoulder exam on one of our patients. And I was like, oh my goodness, I do not remember how to do a shoulder exam, but why not? And I think that just practicing and trying out new things on a real person was really cool.
Yeah, I'll say I agree with Emma and Ethan. One of my favorite things was just learning how much I learned first year. Like you sit in class or, you're studying all day and just like not knowing if you're like retaining it, not knowing if you're like making a difference. But just like realizing when I got into clinic, like I knew the names of the meds people were on, and like I understood something about their disease. Like that was just really cool to see that come together. I really liked that. And also just the patients were super sweet. Like my preceptor let me interview some patients like on my own before she went in, and just like how like graceful they were with me. Like I was just like end of first year, never seen like real patients before in my life, and they were just like so patient and so kind and like so open with me. And so that was just like really like a memorable part of it, was just getting to interact with patients as a provider, as a going into second year. Crazy.
Thank you. We had one other question so far, and that it might only pertain to Ethan, but what was your project to satisfy the program requirement? I think Neomed might be one of the only ones that have an additional project as part of the summer. If you want to share about that, Ethan, that'd be great.
Yeah, so the project that I did, St. E's is really nice. They incorporated my research component into my schedule. So I had dedicated time to do my research project, like along with going to clinic or whatever. But the study we did, I was just basically responsible for going around and following the medical assistants and nurses in different departments of the hospital, and then observing them take blood pressures and seeing how well they like followed AHA guidelines basically. So I had this huge checklist of like, was patient seated for 5 minutes? Was patient talking during the blood pressure measurement? And all of those other components that we learn about in terms of taking a proper blood pressure measurement. And then I would just check off during the encounter, like, did they do it or did they not? And then I compiled that data into like a data sheet. And then outside of that, I presented a poster at Neomed for the symposium. And I think that in terms of the requirements, that was basically it.
Thank you. And some of you may end up being part of a quality improvement initiative, or if that's something that you're interested in, I'd say go like ask the team or ask your physician if there's a project or something you can get involved in that way. I think some students in the past have created patient materials, pamphlets, things like that. So definitely, if that's something of interest or something you want to add to kind of your resume sort of thing as you're building it up, definitely ask. I'm sure they'd always love extra work being done for those kind of things. So it's not a requirement, but still interest. I think you could do that. Okay, I don't see any other questions in the chat. If anything comes to mind, feel free to unmute and ask. We've kind of talked a little bit about some of the things or your favorite things you did in your rotation. Are there any other type of procedures or just any other type of things that stood out during your rotation that you got to do?
Oh, I got to drain my first ear during it, and it was kind of sad because there was like this freaking huge impaction in the patient's ears, and I was like one flush away from getting it out. So I did like 3, and then I was like, okay, I'm done. And then resident came in, she did the last one, and this huge glob just came out, and I was like, oh wow, I was really one away. But yeah, it was really nice because it was kind of one of the first times where I got to see some of the abnormalities that we talk about. It's like, oh, if the patient has this, you'll see this or you'll hear this. But then actually going in there and like listening to it yourself, like I heard my first murmur too as well during that. So it was just really interesting in terms of getting to see the actual abnormalities.
Yeah, I think another big takeaway about this program is how much you can do in family medicine. And it's, I'm sure we'll hear this be repeated throughout the session because it is redundant, but it's so true. I remember I would come home to my roommates every day and just have a million stories to tell them, like, oh my gosh, I did a skin biopsy. And I also, did like a corneal test to see if someone had something in their eye. And then after that, we played with a baby. Like there's just so much that you get to do in one day. And it's really awesome that family medicine has procedures that other fields can do. When a person like has a primary care physician, you realize how important that relationship becomes with your patients because you can do a lot of the things that they don't need a specialist for. So at least for us, we did a lot of like knee injections. So that way our patients could feel comfortable with their primary care physician to do these knee injections. They didn't have to go to a special sports medicine place. And then also if they needed a pap smear, you could go ahead and do the pap smear while they're there too. And it was just really awesome that you can build a really deep connection with your patients and be able to kind of be a jack of all trades with a lot of different procedures and other stuff, other management.
Yeah, I'd say like other than getting to interview patients, which I really liked because I just needed the practice, also just like presenting to a physician, like I got practice with that. I got to see also like knee injections and a couple like abscess drainages and stuff like that. So like some cool procedures, but also just like seeing my physician like remember every single patient that came in, like she knew them and their history without even like looking in the chart review. Like she like just by their name like knew like so many things about them and would tell me in the huddle like all about them. And I was like, I don't know if I'll ever like remember my patients like that. But then I found like when I got to see them, and since I like did my program continuously for like a month or 6 weeks or something like that, I got to see some people for their follow-up, and I was like, oh yeah, like I remember them, and like I got to ask them questions, and I remembered why they were there last time and like what they told me about their family or their dog, and I was like, oh, like really doing it, like it's so cool. So like I think that stood out the most, even more than just like the medicine, just like, oh, like I actually can do this, like I can see myself doing this every day. It's really cool. Yeah.
I love that. That's definitely like a huge plus that we hear time and time again about family medicine, just that continuity of care with your patients and that relationship. It's really special, I think. I don't see any other questions. Okay, let's see. Reflecting back on your last week, so you finished your rotation. Do you wish that there was anything you would have known during your first week? I need to call on someone again. Who's ready?
I can go. I guess one thing that I would say I wish I knew my first week was definitely don't be afraid to say yes to things. And sorry, I muted myself on accident. I mean, it is the most low stress environment, and you probably won't get an experience like this again before rotations where there's no stakes. You have someone supervising you if anything goes wrong. And I mean, it's not like you will be doing anything where something can go horribly wrong, but I think it's just a really great opportunity to ask the questions you want to ask, do the procedures you want to do with no fear of putting yourself out there and practicing. So at least I know I also didn't start interviewing patients until probably my second or third week because I was so nervous that I would do something wrong or that I would like freeze and the patient would not, know what to say. But then over time I was like, this is just such a low stress environment. I should take them get the most out of it by practicing as much as I can. So I would say from day one, just get in there and try to expose yourself. And like Anna was saying earlier, the patients are so nice and they love med students. So some of those patients, like I'll literally remember forever, and I can still remember like things that they said to me and how nice they were. So you'll get a lot of great experience if you just get in there and try things.
Kind of echo what Emma said, and yeah, like asking for the things that you need to. Like I feel like my first week I didn't know that I could like ask for the list of patients we were going to see that day, to like take my notes. Like I didn't know that like I could ask the nurses if I had a question about something, or like I could ask them to show me where like things were in the room, that kind of stuff. Just like not knowing that I could use my team as well, like even as the med student, like that people were willing to like let me be part of the team. But I got more comfortable as I went. So I'd just say, like, don't make that mistake and wait until like the second or third or fourth week to like, really like become part of the team, because like they want you there, they invited you there, and they want to help you learn too. So yeah.
Yeah, to echo the points that Emma and Anna made, the people there, like they'll make everything so welcoming. They want you to go there and just to learn. It's super low stakes. So that's one thing I wish I knew, is just like you can go in there, not know a thing, and you're attending or your residence, like, it's okay. You're just a first year med student, right? But something else I can add for this is that in terms of the stamina that you need to get through some of these days, just because since you are, basically end of your first year, there's so much of the pathology, pharmacology that you don't necessarily know yet. You might not have even hit some of the body systems that they might be covering in a visit. So kind of just keeping yourself mentally on throughout the whole day, because there's so much you don't know. Like sometimes it can be pretty draining, but it's such a rewarding experience because you get to see these things. And for me, like the connections that I made in the clinical environment, like when I learned something there, it stuck. like compared to if I just look at it in a textbook, I was like, oh, okay. And then like a week later, I won't even remember it. But in the clinic, there's things that I can remember now where last summer I can remember it like it was yesterday, like the details that we covered. But yeah, it definitely takes a lot of stamina some days to get through just because you're mentally exerting yourself the whole day.
Yeah, that's a really great point. And I wanted to echo about the whole team. If you wanted to shadow a team member for a day or half a day, I think that's totally like good to do, and just really see how the team interacts with each other is really helpful as well. So I'm glad that you have the team bringing you in too. And speaking, maybe, I don't think I have this as a question, but you kind of touched on just all of this information coming at you and it being so draining. Was there anything kind of in the mental health space, well-being, kind of through that time that you've had help keep yourself grounded? I know it's summer months and this may have been the only focus at the time, but anything to kind of help in that space a little bit that got you through?
I think just in terms of enjoying your time outside of like the clinic or the environment that you're in, making sure, you know, it's still your summer, right? You want to enjoy like you're attending or whoever you're precepting with, like they'll tell you this is the best summer for you to enjoy. So like don't go in, even though you know you might see 20 different things that you didn't know, like if you're tired at the end of the day, just save to read up on it a different time. Or if you know, like, even though it's a busy day, like I still need to go and exercise or something, or just calm down and watch like a movie or whatever, however you like to enjoy your free time. I would just make sure you still remember to allow yourself to enjoy your summer.
I would definitely agree with Ethan. Just I like hung out with my friends a lot outside of like my rotation, but two, I guess, highlights that I would say is sleep. That's definitely my first thing. I knew I had to be up in the morning, so I definitely wouldn't go to bed late. And I think that helped a lot, especially in the mornings. So actually the afternoon is what can get really long because you're just like, oh my goodness, I'm so tired, I want to go home. But you know, just always thinking about that next patient could be like an awesome experience, and a lot of the time it was. So it's not something that's too draining, but definitely I think sleep will help. And then my other point was that some days my preceptor was really chill, and she'd be like, you know, if you want to go, we only have like a couple more patients left, and they're really just repeats of what you've seen. And I just kind of wasn't shy. Like if I was pretty tired, I was like, you know what, you're right, like I'll probably go home if we're just seeing some cases that are exactly the same as what we saw this morning. And then other days I'd feel up for it and I'd stay. So it really depends on how you're feeling that day, but also just don't be shy. If you're like really exhausted and you need some me time and your preceptor's okay with it, it's okay to go home a little early sometimes.
Yeah, I think I did almost exactly what Emma did. Slept a lot. Like I would go to clinic and come home and eat dinner and then basically like go to bed because I was just drained and tired and wanted to be like ready for the next day. So just like really like keeping on my sleep schedule was really helpful. I also like made the most of my weekends. Just, you know, did fun, relaxing things or like things with my friends and with my family over the weekend. And it was kind of fun. I actually was staying at home during my preceptorship because I live in Athens, but my family's in Dayton where I was, and like being home and like going to work at the same time as my dad was kind of fun. Like being on the like working schedule was actually kind of like refreshing to me. I actually really liked it. So that was another thing that I learned, but also just like really being on my schedule and like protecting my time during the week when I needed to like sleep and catch up on rest, and then doing more fun things on the weekend worked for me, but whatever works for you is good.
Thank you. I love that. It's important to remember you all are humans too. So you definitely need to get the rest when you need it and do all of those things for sure. And I think that's really cool that you got to go home and be with family those times. I think that's a benefit of this program too. Many of you are taking advantage of that, just being able to go to a site near home, which is great.
So I had a quick
Yeah, go for
question.
it, go for it.
So how much of your time was spent just shadowing or observing, and how much time did you do something or were able to, I guess, do something with the physician or do something on your own?
I can jump in. I'd say that for me, I think maybe 2/3 of the time I spent shadowing, and then like a third of the time I like saw my own patient or like did something on my own, and had my own like tasks to do. And I think kind of like you kind of start slow and then you build up, like they get more confident in you, they like learn who you are and like how much you know and like the things that you can do. And so it kind of like builds, but by the end of the time I was seeing maybe like every other patient in the afternoon I got to see before the doctor went in. And I think it depends on like slow days, fast days, whatever the doctor's schedule is like, kind of like it varied. But I did get to do a lot more on my own than I thought that I would get to do going into it. So it was really like a good experience, and I felt like I had some autonomy with it.
I would say the same, that it took a few weeks to kind of build up, but I also definitely was very active during the shadowing time. So for listening, like doing the cardiopulmonary exam, I always co-listened with her. So she would listen on one side, I'd listen on the other for both the heart and the lungs. And then if we would do like an abdominal exam, she would do it first and then I would do it second. So definitely, like, even in the shadowing part, I was still participating. And yeah, and then as you go on, you start doing more like interviews by yourself.
Yeah, I would say I was about like 60% shadowing, 40% doing stuff on my own. I felt like it was kind of similar with like building up to being able to see more patients by yourself, but you do feel really, really like, I don't know how to put it, like useful, like you're valued because they're trusting you, like once they get to know you, to go see basically, you know, almost every other patient and then synthesize that information, come back to them and give them a nice presentation or whatever, just some quick details so that they have an idea of what's going on and they're trusting you to do that. So it is really interesting to see. But yeah, I'd say about 60% of shadowing and then about like 40% of something more engaged.
I have kind of a follow-up question to that. When you got to do things, did you get feedback from your preceptor, or is it a lot on your own? Yeah.
So I got feedback from my preceptor. Like I would go in, see a patient, and then I'd present to her and she would give me feedback. And then when we went back in to see the patient at the end, I like, if there was an opportunity, I'd usually ask the patient if they had any feedback for me. My preceptor was chill with that, so she let me do that and it was okay. But then I got a lot of feedback.
Yeah, I feel like I also got a lot of feedback too. Whenever I talk to a patient, I would talk to the resident afterward, and they're always super helpful because, you know, it's kind of hard to have an idea of how to take a focused history and ask certain questions to narrow down a diagnosis when you're just in M1. So like there's so many moments where I talk to the resident after and she'd be like, oh, actually this commonly presents with this. Did you ask them this question? And I'd be like, oh no, I didn't. And so it was like a good learning experience that way. And in terms of like actual physical exam techniques or procedures and stuff, like if I did that, there was always somebody watching me and supervising me. So they'd be like, oh, try this differently or auscultate here, not here.
Did you have anything else, Emma? Thanks for those guys.
Yeah, I think I'm trying to remember. I would say, I guess, based on feedback, definitely ask for it because you won't always get it if you don't. So, if you want feedback, you are certainly welcome to ask. But also along that same note, I would say that sometimes your interviews or your patient interactions won't have anything to do with medicine, and that's okay too. Like sometimes I'd go in the room and I remember very vividly this one patient that just talked to me about swing dancing the whole time. And then I was like, okay, it's been 15 minutes. Like, it was awesome talking to you. And I'm just going to tell her we had like a nice little conversation, and that's fine. So, it's fun to kind of have those moments where you also just get to have no repercussions for just having fun with the patients too. But yeah, so that was pretty much the same idea.
Great, thank you. Okay, were there any challenges that you faced, and then how did you overcome those?
I can go. I think probably one of the biggest challenges that I had was just kind of being able to keep up with what the doctors and the residents were talking about in terms of like treatment, or if they're really going into the pathophysiology. I just didn't have that knowledge yet. And it was something really hard to do, and but like what Anna said, if you use a Post-it note, or if you have like a piece of paper on hand or something, if you can just take the notes, like up to date will be your best friend when you're on your preceptorship, because there's going to be so many things that you're going to need to look up. But I thought that was just like the hardest part. If they're talking about why they're choosing this antibiotic over the other one, and you're like, what does that antibiotic even do? Then, it's kind of a tough situation. But it's something like you'll realize early on, it's okay, I don't have that knowledge yet. And then you just try to keep up with what you can, the pieces that you can, and then try to read up a little bit after that, so that the next time they talk about it, you do have an idea.
Yeah, I think we've already hit on it a lot, but just like the stamina, I think was the biggest challenge, was like just underestimating how exhausting it can be to like see patients all day when you've never done it before. I ordered some compression socks because we stood a lot, and I realized that my shoes weren't probably good enough quality to be standing for all that time every day. So that's one thing, but like really it was just like a really chill, low stakes environment. And so I think that the biggest challenges were more just like, showing up for that long and being on for that long, and not so much like conflicts or anything like that. So it was nice.
Thank you, thank you. Are there any, I know you mentioned UpToDate, did you use any other apps or tools, or is there anything, or is this just kind of common knowledge, everybody knows these things? Are there any apps that were helpful at all?
I like MDCalc, which has like the MMSE and stuff like that. We used MMSE, like the mini mental status exam, a lot for our patients. And so it was nice to be able to pull that up on my phone. And I use Amboss. I'm a big fan of Amboss. So those were mine.
And I may be out of the know, and you all know these things already, but just didn't know if there's other tools that everyone was using. I know you mentioned blood pressure checking for your project. So the OASP years ago, we have a really good blood pressure video, and I'll send it to you all just as a random tool. It's on YouTube. One of our coworkers was in it, so we like to share that out. But it has lots of views on YouTube. If anyone needs a good blood pressure checking video, I'll send it out. Awesome. Well, I think that was our main questions. And we just had one that was just on general advice for your M2 year. Just kind of switching gears, if there's any kind of parting wisdom or anything, just kind of over the past year you've had just in medical school. We can kind of open it up to general questions if anyone has it, just on kind of what you all are heading into and what the three of you just finished. General advice on the next step. Lots of sleep.
I guess I can talk a little bit. I don't want to steer too much away from the program, but I think a lot of clinical experience is wonderful. You remember things best when you see it. So anytime that you see a program like this, or even if you just want to reach out and shadow, I wish I had probably done that a little bit more. So get as much clinical experience as you can. And then also generally for M2 year, I am actually taking STEP on Monday. So I would say that study a lot. I feel like maybe if I could go back and change something, I would definitely try to, oh, thank you for the good luck in the chat, but I feel like if I could go back, I'd probably try to understand things more than just in the context of like lectures, because I feel like I was very a passive learner where I was like, yeah, I don't really need to know this, but I wish I'd done more like active learning, and applying that in a clinical setting I think is a really good idea. So if I could have done more shadowing, I would have done that. And then with studying, I probably would have done like more resources like first aid and more visual stuff to kind of synthesize information, because it all comes back.
Yeah, to echo what Emma said, getting more clinical experience is really nice if you have like the time during your M2 year, just to, it helps build your skills for sure. And also to learn new things and just to get more of like a footing in the clinical environment. In terms of just general M2 advice, I would say, like Emma, I was more passive than I wanted to be in terms of my learning. I think probably a great, like if I could have done something different, I would have definitely incorporated a lot more UWorld into my studying. I did still a decent amount of UWorld, but that would have been like one of like the main things I would have done if I could go back and change anything. And also, like in terms of board resources, they're really great. Like First Aid, B&B, Pathoma, Sketchy, like make sure you use those, because sometimes it's hard to tell if the points of emphasis that your school has in their lectures necessarily correlates with what they're going to be asking you on STEP. And sometimes it can get really overwhelming. So if you supplement what you're doing with your like lecture material with, say, like your B&B or first aid or whatever, you'll really get to those points where it's like, okay, most likely if I see this condition, they're going to ask this. And then that helps you kind of hone in on what you need to be focusing specifically for STEM.
Okay, my advice for second year is, first of all, just enjoy it. Like or at least for our school, we go off to different clinical sites for third year. So like this is the last year that our whole like cohort is together. And so just like enjoying time with the people in your class that you like spending time with is really important. And I think just everything's a balance. There's always more to be studying, and that's okay. And even after second year, like we're not going to know everything. We just have to know enough to pass our exams. We just have to know enough to show up and give our like best foot forward. So like it's okay not to know everything, but it's also okay to like study and study and study and have to study it again. Like that's just our job. That's what we signed up for. And so like just don't be discouraged. Like everything's going to come together and everything is just going to build on what you already know. And so just like it's okay to be where you are and just keep going, just like one foot in front of the other. Yeah. I don't know if that's helpful. I also used a lot of like board resources and stuff. We just finished our semester on Tuesday, so I have like a whole month before my board exam. So I don't know exactly what dedicated is going to be like yet because I haven't been through it, but you just keep going every day. You just do something. Yeah.
That was great. Well, I'll give everyone just a few last minutes if you have any final questions, and just turn it over all to you. If there's something I didn't ask or anything that you wanted to share with the group before they head into this family medicine experience this summer. Any closing thoughts from from each of you would be great.
I had one more question. I
Yeah,
think
go for it.
for Emma, I believe you said that after this experience, you wanted to do family practice. You decided on that. Was it like any experience in specific that made you make that decision, or just in general?
Great question.
Is an awesome question. I think it was more in general that I realized, even though I really love kids and I always looked forward to seeing kids every day, I would like scan the list of patients every morning and be like, oh my gosh, at 3 o'clock we have a baby. But at the same time, I realized like I would just really love all people, and old people can be super, super cute too. So I really loved that. But I guess in particular, though, I really loved the mental health aspect of management with family medicine. We managed a lot of like both medical and a little bit of like counseling with our patients. My preceptor would always call herself like an amateur psychiatrist. So I thought that was really, really neat that we could do a lot of mental health work, but also manage other parts of a patient's care. So I think that's really what turned me, where I was like, I care so much about kids, but what if I could see kids and also do, some mental health work with adults and do some women's health care as well. So I didn't want to give up every like other things that I love to do, and family medicine was like the perfect route where I didn't have to give anything up. I could do all of it.
Yeah, I'll jump in on that too and say like I had a very similar experience to Emma where like I went in like thinking that I liked family practice, but like not really knowing, and then coming out of the summer and being like, I definitely want to do a family med residency. And I think the thing that I learned is just how like you can specialize family med to like your own preferences. Like you get to do like there's so many different things you can do, like procedures, women's health, all of the things you get to do them in family practice, but you can also then like tailor your patient and like the patient care that you want to do to like those interests too. So like I'm really interested in diabetes. In family practice, I can work with kids with diabetes and adults with diabetes and take on more diabetes patients if I want to, because that's what I'm interested in, as well as like managing other things. Like I don't have to do like a specialty to be able to specialize in seeing those patients. And I just really like that, and just like getting to see babies to old people and like all of that. I think it was just like realizing that in family med, you can really make it your own. And I thought that was really cool, and I'm excited about it.
I won't put you on the spot, Ethan, if you don't feel the same.
Oh no, I came out of it like really loving family medicine. That's what I want to go into.
Amazing.
Like Anna and Emma said, there's so much versatility, so much customization that can go with family medicine. And like for me, it was just I really like taking care of kids, but I also like taking care of adults. So I was like, I could take care of both. And you get to keep a good knowledge of all the body systems. It's like I didn't want to give up anything. So it's just the specialty that does everything is family medicine. So I thought it was such an incredible program, and I was really thankful for like the people that I got to be able to follow and work with, the culture. Like if anybody's interested in St. Elizabeth Boardman, like if you're in the Youngstown area, they have really great primary care. The culture there is amazing. We had a Nerf war at the end, I'm pretty sure. So yeah, like towards the end, like all of the residents and attendings got together with their huge Nerf guns, and I was able to be a part of it. It's just seeing that type of culture in family medicine as well, like knowing that the people there are very relaxed, they're chill, like they really value their relationships with their patients, and yeah, it's just really great specialty. So
I think those are pretty good closeout statements too. But if you have anything else to add, feel free. We'll give everyone another minute here if you have a question. But I really appreciate your time tonight and sharing your experiences and what best practice sharing we have from this program, that you're all looking forward to a career in family medicine. You guys hit the nail on the head. You can cover so many different things throughout your career path. You can ebb and flow and change it up as you go. It really gives you a great foundation to kind of build it as you want it. So thank you for those. Yeah, I'm excited to get going. Well, if there aren't any other questions, we can let you all have the rest of your evening. I did mention that I can keep this open if anyone wants to connect with each other. Feel free. I'll just kind of leave it open, but also I know it's a very busy time with studying and everything else. So you can also just go on with your evening, but always remember you can reach out anytime if you have questions as you're getting started. I think most of you have your preceptors, but if not and are still struggling, let me know. Yeah, and we're here for you throughout this experience. I'm sure I don't know if the three of you would want to share your emails, or I could share it out. If anyone has any follow-up questions, that would be awesome. I'll send that out to everyone too. Thanks, everybody. I will stop the recording at least.